Hello, everyone. Today, I would like to reflect on a compelling article that appeared on the list of the 10 must read bioethics articles published in 2024, and it is for the American Medical Association Journal of Ethics. The title of the article is When Should Patients at the End of Life Get Antimicrobials? This article explores the bioethical dilemma of involving the use of antimicrobial therapy for terminally ill patients, especially those transitioning to hospice or comfort focused care. The featured case in this article centers on a 75-year-old woman with metastatic lung cancer who is no longer receiving curative treatment. And as she prepares for hospice care, she is faced with the difficult decision of whether to continue taking antibiotics for pneumonia. The bioethical dilemma centers on whether such treatments provide meaningful symptom relief or instead introduce unnecessary harm and contribute to antimicrobial resistance. This topic is deeply meaningful to me as a nurse because it challenges my role as an advocate, not only for individual patient comfort and dignity, but also for responsible management of public health resources. In my daily practice at my workplace in an urgent care center, especially when caring for palliative patients, I've seen how decisions around treatment at the end of life can be clouded by hope, uncertainty, or pressure from families. In the urgent care, we frequently encounter patients and families who expect immediate antibiotic treatment, sometimes without a full understanding of the patient's overall prognosis or goals of care. There are several primary bioethical principles being challenged here. The first is autonomy. It is challenged when patients are not given complete information or an adequate opportunity to discuss antimicrobial use in advanced care planning. Without informed consent and transparent discussions, patients may receive treatments that do not align with their values or goals. The article states that antimicrobial use is often not discussed at all during advanced care planning, even though it has significant implications for patient comfort and quality of life. Beneficence is challenged when antibiotics are prescribed with the intention to help, but may provide limited or no benefit in symptom relief for end of life patients. The article itself states that in some cases, symptom improvement occurs in only about 60% of patients, which raises questions about whether treatment truly promotes the patient's best interest. Non maleficence is threatened due to the risk of adverse drug events and antibiotic related complications such as gastrointestinal distress, C. diff infections, and even pain associated with invasive IV therapies. Administering treatments that may do more harm than good violates the principle of do not harm. And justice is also violated when inappropriate antibiotic use contributes to antibiotic resistance, which affects not just the individual but the broader community and future patients. The article highlights that only 15% of patients receiving antibiotics in the final week of life had a documented infection, indicating the overuse and poor resource stewardship. Now, let's discuss the relevant nursing code of ethics. Provision 1. It is violated when nurses do not fully involve patients in discussions about antibiotic use during advanced care planning. Provision 2, which is the commitment to the patient. This provision is generally respected when nurses take an active role in facilitating honest conversations about whether antibiotics are consistent with comfort focused care. Provision 5. This provision is at risk of being violated when nurses administer antibiotics at the end of life without evaluating the appropriateness of such interventions, especially when the likelihood of symptom relief is minimal or even uncertain. And Provision 8. It is respected when nurses advocate for antimicrobial management and recognize the societal impact of overprescribing. However, it is violated when antimicrobial use continues unnecessarily, contributing to resistance that may harm future patients. The ethical considerations surrounding antimicrobial use at the end of life are important in nursing and other health professions because they intersect with patient advocacy, clinical judgment, public health responsibility, and the preservation of ethical standards in care delivery. Nurses play a central role in advanced care planning and are often the first to help patients and families make informed decisions. And when the antimicrobial use excluded from these conversations, Patient autonomy and dignity may be compromised. Nurses also have a responsibility to practice antimicrobial management because overuse of antibiotics in terminal care can cause harm and contribute to resistance. This reinforces the nurse's role not only as a bedside caregiver but also as an advocate for ethical and sustainable care. And finally, the issue highlights the need for education and policy updates. Many nurses lack training in discussing end of life antibiotic use. Including these discussions in advanced care planning or post forums can help ensure that treatment align with patient goals and upholds ethical standards. A major policy identified in this article is the lack of clear guidelines for antimicrobial use at the end of life. Despite common use in hospice care, antibiotic decisions are often missing from ACP or post forms, and it limits informed and value-based choices. Another concern is the limited training for nurses to discuss the risks and benefits of antibiotics in these scenarios. So here are some recommendations of what can be done. The first recommendation is to add antimicrobial preferences to the ACP and post forms. Another recommendation is to create national guidelines on appropriate end-of-life antibiotic use. Third recommendation to expand nurse education on ethical prescribing and communication. Another recommendation is to encourage interdisciplinary ethics consultations for complex cases. And finally, is to raise awareness about antimicrobial management through public and professional campaigns. As I conclude this presentation, I would like to provide all of you with 3 discussion questions about this topic. The first question is, what factors should be considered when deciding whether antibiotics at the end of life are used for symptom relief versus prolonging life? The second question is, how can we as nurses or nurse practitioners advocate for ethical antimicrobial use when facing pressure from families or other providers to continue treatment? And finally, the last question is, in what ways can nursing education better prepare future nurses to handle end-of-life ethical dilemmas, especially related to antimicrobial use? Thank you very much, everyone, for your time, and I hope you all have a wonderful day.